Okay, it is 3 o'clock Eastern Standard Time, and this is another episode of Dr. Yass Live. And today's topic is function, to be or not to be. I thought that was kind of a coolish play on words. And the reason I wanted to discuss this issue is because most people who seek medical assistance for symptoms primarily will seek that at the point at which they can no longer function. For the average person, if you have knee pain, back pain, some sort of pain, shoulder pain, as long as you can get by and you're able to do your activity, you say, I guess I got to live this way and I have to suffer. But at some point, if the symptom gets to the point where it's affecting your ability to function, you can't work, you can't do recreational activities, you can't be a mother or a father, you can't care for a parent. That's when stuff really gets difficult, and the limitation, the inability to actually perform these activities starts to hit home, and you're at the point at which you say, I got to do something. It's not just symptom anymore. I can't do what I need to do. So people then begin to seek care. And that's usually the beginnings of how this starts. So I wanted to talk about function and what exactly is responsible for function, and what's the best diagnostic model for identifying the tissue that's affecting function. So I want to start off with something that really cool that happened last night. I was doing this Skype with a woman who was having some shoulder issues. And it was really, really awesome that her daughter was willing to help her in the session. A lot of what I ask people do is I have to do certain testing in the initial phase of one of these Zoom or Skype sessions because I'm trying to diagnose the tissue in distress. And oftentimes it can involve doing certain tests where if there is a person available to assist me, it's always a great thing because it just reinforces how these tests are used to identify the tissue in distress. So this girl was helping me. It was really great. She was a great daughter helping the woman out who I was working with. And so somehow we get onto the topic of her, and she starts talking about the fact that one of her great difficulties and biggest problems is the fact that when she goes into her closet to try to look through her clothes to see what she'd like to wear at that particular time, she cannot hold her arms up more than 30 seconds without them feeling like they're lead weights and they drop. Now, that could be a problem because if you can't pick out your clothes, it's hard to get through the course of the day. And this woman had children, so she has to get their clothes out. And you could imagine that there's what about cooking, right? There's a multitude of items and activities that have to be done with your hands in front of you. And so it was fascinating to me. After 27 years, you think you've heard everything. And then something like this comes along, and just the way that it happened, that it just so happened she happened to be helping me with her mother in this session. So because I'm so fascinated by these types of circumstances and am passionate about understanding them and obviously trying to provide the answer to this woman so that she doesn't have to live like this any further, I wanted to delve into this further. And I asked the woman who I was doing the Skype with, would it be okay if I just try to understand this a little further? And she's like, of course, it's my daughter, which was a lovely thing. So I start asking her, tell me, what's been done? Well, I've been told that I have neuropathy. I have just a variety of situations because of the fact that, again, the answer is she can't hold her arms up for more than 20, 30 seconds without them falling. And my point to you is that look at what happens. She can't hold her arms up, which certainly is peculiar. Don't get me wrong. That's certainly highly unusual. But what tissue is responsible for that functional activity? wouldn't everyone have to acknowledge that muscle is responsible for that activity? And yet, the instantaneous response of the medical system is to assume neurological. It must be a neurological deficit, something from the brain, something from the spine, something neurological, right? But let's think of the symptom in whole. Does she have this excessive sense of weight of her arms when they're at her side? Does she have that when she's laying down? Does she have that at any other time other than when she's trying to hold her arms up? No, right? So if it was neurological, some sort of nerve impulse that's being limited at the spine or the brain or something, why wouldn't she have that sensation constantly? If it's from something that's structural, you have to assume that the symptom must exist. Remember what they're saying structurally. They're saying that there's an impingement or neuropathy by definition, pathology of a nerve, is that there's some degradation of this nerve. They haven't found one. They haven't been able to identify anything. But because you go to a neurologist, you have not a lot of choices for him to give you a diagnosis. So he says neuropathy. And my point to everybody is you have to have a physical presentation to make a diagnosis. And as far as I'm concerned, I've never heard of a single person who has described the physical presentation that indicates that there is a pathology of an individual nerve. Now, cystic fibrosis, multiple sclerosis, now you're talking systemic deterioration of nerves. But an individual nerve deterioration doesn't exist. That's why I constantly try to point to people that the diagnosis of neuropathy is a baseless diagnosis. Doesn't mean anything. You got that from a neurologist, and that's all a neurologist could say. Just imagine if you had the same symptoms and you went to a mechanic. His answer is you need an overhaul for your engine. I mean, wacky, right? But what would you expect a mechanic to say about the fact you can't raise your arms? He's going to try to put that into context of what he knows, just like the neurologist. That's why it's so insane to go to anybody who's not capable of understanding all possible causes, which is what the Yass method is capable of through its interpretation of symptoms, which I'm going to explain now how I figured out what was wrong with her, and allowed me to prove in under 10 minutes that I knew exactly what the cause of that symptom was. So I said, I want to do an experiment with you. Put your arms out. Let's see how long it takes for your arms to collapse. And like within 30 seconds, seriously, she said, I cannot hold my arms up any longer. And they dropped. So you have to understand about the mechanism by which holding your arms up works. And the way it works is that there is a portion in the front of the arm, the anterior delt, that helps to raise the arm. But beyond that, partly what's happening is there's a muscle in the back that pulls the shoulder blade down. And in pulling the shoulder blade down the back, it helps to raise the arm. So I said, and this is just an ability to understand biomechanics and the way movement occurs, function, the way function occurs. So I said, let's do an experiment. So that muscle is called the lower trapezius muscle. And what we did was she did 3 sets of 10 repetitions with the lower trapezius exercise. Then I said, okay, she only did it with one arm, the left arm. So I said, all right, now let's try the experiment again. Put your arms out. She puts her arms out, and with about 20 or 30 seconds to go, she's like, oh my God, I can't hold my right arm up anymore. And you literally are watching this thing collapse. And yet the left arm stays upright. And eventually she says she got a little nervous because she feels this having an inability. Consciously, she's saying, I want to hold you up, but she can't. And that kind of freaked her out a little bit, which I would imagine is scary when you assume you should have conscious control. And she just dropped it. And yet she was still able to keep that left arm up. So what I did was show that the description of her symptoms being that she can only get this symptom, this heaviness of the arms, when she tries to hold her arms up for a period of time, 30 seconds or so, that has to be muscular in nature. The idea that somebody immediately jumped to the idea that it was neurological is baseless. It's a fallacy because nothing in her description would lead you to believe it's neurological. It was just called neurological because you went to a neurologist. I want you to really wrap your head around what happened here. She was getting nowhere. This was just going on longer and longer, and she was seeking other people to try to help her understand what was causing this, and no one could understand it. And it was really affecting her function. Through the understanding that comes from the Yass method of being able to interpret symptoms, not just pain, but what brings on the pain, what makes the pain go away, whether it's whether it's structural or muscular. These are the type of things that help you come to a conclusion as to what the tissue is in distress that's eliciting that symptom. And in this case, it was a deficit of strength of the lower trapezius muscle. I was then able to prove it irrefutably by strengthening the lower trapezius muscle on one arm. She was ecstatic. She went ballistic. It was so satisfying and just such a sense of grace that I get from helping somebody see that there's a solution to their limited function. And best of all, it's just muscle, which she can now go on, do that exercise plus a couple of others, and she will have complete function again. Versus staying in the medical establishment on this carousel of practitioners who are not capable of identifying all causes of symptoms, not even willing to try to interpret the symptoms because it's not part of their curriculum, and leaving the person left to either exist as is or be on medications, which have their own side effects, their own problems associated with them. Never think that the answer is, oh my God, I'm taking a medication and it's going to help my symptoms. This is great because trust me, there's some other symptoms around the bend that are coming from the medication that you're taking. Usually then you have to take medication for the symptoms, the side effects of that medication. And that's how people end up that I treat who are on 15, 20 medications. Medication doesn't fix anything. Medication alters symptoms. That's all they do. They try to bring symptoms into what would be perceived to be normal. But clearly, they're not addressing a tissue in distress. Can everybody please understand that idea? And so if you don't address the tissue in distress and resolve the distress of that tissue, that will continue to fester forever and ever and ever. And all you're doing is taking medications to just minimize its effect on you. But there are side effects to that medication that may have a greater effect on your life expectancy and your functionality. So you really don't want to take that path. You want to try to find the answer to what tissue's in distress. So that was just a wonderful, wonderful experience that I had last night. It was great because it was completely unexpected. I really had no idea this was about to happen to me. And just the ability in her description to be able to understand what it was and then prove that it was dead on one primary muscle responsible for the issue was just fantastic. So then I want to talk about another person. This guy I've been seeing for about a week. This guy's had a problem for 6 years, and some of you may be able to associate with this idea. He says that when he's standing for a period of time, and it's just completely arbitrary, all of a sudden he feels like his legs give out and he falls to the floor. That's the symptom. And over a 6-year period, this has happened multiple times, and he doesn't know what's causing it. And they've tried the diagnostic tests, and they can't seem to figure out, again, the brain scan, the MRIs, everything. Nothing's been figured out. And he's really getting angry because they keep saying the same thing to him. You know what we think? You just need to watch it more. Just watch it, and maybe we'll be able to figure it out. Well, it's 6 years down the road now, and he's still watching it. So he is angry, really angry, and fully understandable. And so I come in and I start talking to him, and I start asking him questions. Tell me about, is there a specific time that this happens? A specific position? Are you doing something specifically? Does it happen when you're laying down? Does it happen when you're sitting? Does it happen when you're standing? Is it the same size? Is it when you say that you're going down? Is it that pain brings you down? Is it a sudden sense of weakness that brings you down? Is it that you lose your balance? Is it that you blank out? These are the kinds of questions you got to ask. You got to really, these are all representations of symptoms. Symptoms aren't just the actual pain itself. It's all the stuff associated. What brings it on? What makes it better? What makes it worse? When does it happen? All these that describe the symptom itself. And then you go on from that and start to do physical evaluative techniques to see if you can determine what tissue's involved. So you really got to try to understand all this stuff. And immediately the guy was like, man, I've never met anyone like you. No one asked me these type of questions. They make so much sense. It actually seems like you're trying to understand this. So he kind of lets go with a bomb that really immediately me say, I know what he's talking about. He said the last time it happened, he was standing right in front of the sink. And all of a sudden he went to bend down to wash something and his legs gave out. And he hit his face and hurt himself and all that other stuff. And as soon as he said that, it made me think to myself, this guy's hip flexors are severely shortened. And what the hip flexors or psoas muscles are, they're the muscles that attach from all 5 lumbar spine, run diagonally from the back forward and attach at the hip joint. And they kind of control how much arch you have in your back. So if the hip flexors are severely shortened, then you're going to have an extreme arch in your back. Not the normal, very mild lordosis or arch, but an extreme arch. Now, here's the thing you want to understand about a muscle. A muscle, when it shortens, loses its ability to create force. So if he's already gotten these shortened muscles and he suddenly goes to bend forward, he just took his upper body and put it in front of his ankles. So he's created a load in front of his body that he has to support. And the muscles that typically would support it are these hip flexors, right? So it's trying to support them, but they're already shortened. With this excess load, will shorten them to just a point further, and it literally will cause the 2 fibers to bypass each other completely, making it impossible for it to create force. They no longer can support him, and he falls to the floor. So if you understood, picked up from what he was saying, that he was standing upright and that he suddenly just leaned forward, and it's at 5 degrees, 10 degrees, it's minimal, to do something in the sink, and he suddenly drops down, it's a huge red flag that it's the hip flexors that are in spasm. Now, of course, he's been told he has a herniated disc, arthritis, and all this other nonsense. But again, my point to you is that if these structural variations are the variations themselves are eliciting the symptom, why isn't he having pain at a constant level 24 hours a day, 7 days a week? Because they're constantly there. They're not increasing and decreasing, right? Herniated disc doesn't unherniate and then herniate and then unherniate and then, right? It's there. He says, and he doesn't have it when he sits. He doesn't have it when he lays. Only happens when he's upright and kind of moves forward. So I checked his flexibility. His hip flexors were retardedly tight, unbelievably tight. Then I pressed on his hip flexors, and he went through the roof. And I was able to find massive knotting, and it was painful. So I decided that was the answer, and we started doing treatment. So I massaged out his hip flexors, stretched them, and I started strengthening the 2 opposing muscles that oppose the hip flexors, the psoas muscle, which is the gluteus maximus muscle and the hamstrings. And then I strengthened his hip abductors, which are the muscles on the side, because they provide stability when you're standing and work in conjunction with the low back muscles to help stabilize you and give you support when you're standing. So basically, he's just doing 3 exercises with resistance. His hip flexors were so shortened that imagine he's laying flat in a bed, just trying to come up 20 to 30 degree angle with his back was writhing in pain. He could barely do anything other than lay flat. He could kind of lay on the right side, could not lay on the left side at all. So he was really limited in the functional level he had. Primarily laying on his back for a very slight incline at best, and on the right side. Could not sit, could not stand, could not walk, couldn't do anything functionally. So here we go. We start addressing the tissue associated with function, muscle. The muscles that are strained, limiting his ability to perform function. And It was wild. After the first session, 2 sessions, you're starting to see him sit higher and higher and higher and higher and higher. And after 3 or 4 sessions, he now can sit up at about an 80-degree angle, almost straight up, without back pain. And the last time I worked with him, we actually got him to sit off the edge of the bed, almost being able to put his feet on the floor without pain. So we've overcome all the limitations in going from laying flat to sitting upright, and now he's about to move to being able to sit with his feet on the floor. Once we accomplish that, we have him stand up, and he'll be able to stand without pain and eventually walk without pain. And this should happen in the next week or so. So a guy who's had this symptom for 6 years and has been unable to get anybody to identify the cause as being a muscular deficit has suffered for that very reason. And if you listen to this guy's persona, he's a completely new guy. And we haven't even achieved the full goal yet. But all he ever talks about now is, I now know there is an answer to this, and I know that we will resolve it. And in a very short period of time, I will have my life back. And more importantly, if he sustains the exercises I want him to do, he's going to be able to sustain this functionality for the rest of his life. And you saw a guy who was very depressed, very bitter, and very angry become this really happy, excited guy. His entire personality has changed. All because I was able to associate the tissue in distress as being muscle that was limiting his ability to perform function. So what I want you to take away from this session is the idea that if you go to the medical system and they try to convince you that identifying structural variations in the spine or the hip or the knee joint or the shoulder joint is the answer to resolving functional deficits, you're greatly mistaken. Greatly mistaken. Because those are just points where muscles attach to. And as a result of that, they allow the muscles to pull off of them to allow function to occur. But if we stripped away your muscles and you just had your spine and your joints, what do you think? Would you stay upright? No, you would collapse to the floor. The spine and the skeleton could never support you. Only muscles can support you. They use joints at pivot points to allow motion to occur so that function can develop. But just remember, they on their own do not cause function. Only muscle does. So when you see limitation in function, you need to start thinking more about the fact that the cause is muscular. Vicky wrote, Yass method is real. Blessed to find you, Doc. We thank you. Hoping many patients open hearts and minds to the need to learn, practice the Yass method. Living pain-free can be a dream come true. Thanks, Vicky. Actually, that's the lady that I was working with last night. I didn't know she was on when we worked on that thing with her daughter. And it was just a great, great experience. So that's the takeaway from this. Function, to be or not to be, will be if you recognize the ability to achieve function is done through the muscular system, and that corrections in muscular deficits are the key to achieving that full functional capacity, as well as having a pain-free life. So I think we're going to leave that here. If anybody who watches this likes this and sees value in it, please give it a thumbs up. If anybody comes on to the channel and is watching these videos and sees value in the channel, which I hope they do, please subscribe to the Yass, to Dr. Mitchell Yass, the YouTube channel, because this allows you to get notifications when I'm putting new videos on and when I am live, just like I am now on YouTube. So you'll get some upfront notice when these new things are being added. And by the way, it also helps me because the higher number of subscribers I get, the greater value YouTube and Google sees in what I'm providing, and actually increases the opportunity for those searching certain keywords that plug into the keywords I use to be able to get my video. So it allows people who may never have even heard of the Yass method have a chance to see it and experience it. If you want more opportunity to let me know about your situation. Very personal if it is, and you don't want to ever discuss it on here. You can always contact me at Dr. Mitch at mitchellyass.com, DRMITCH at MITCHELLYASS.com, Dr. Mitch at mitchellyass.com. I am still doing Zoom sessions and Skype sessions if you're looking to have a one-on-one in which I evaluate you, establish the cause if confirmed to be muscular, provide you with a series of exercises to resolve the symptoms. We could always do that. You could email me again at drmitch at mitchellyass.com to get an appointment. And usually I can do them 2 to 3 weeks from the point at which you are requesting the session. I'd like to just ask everybody who knows about the Yass method, who has seen the value in the Yass method, to help try to spread the Yass method. I'm just a lone guy out there with a very unique understanding, trying to get people to recognize that there is a legitimate path to diagnosing and treating the cause of pain and other symptoms, but it is not through the use of diagnostic tests. In fact, I believe that should be abolished. The only true way is through the interpretation of symptoms, which is at the core of the Yass method. In 98% of cases, the cause happens to turn out to be muscular, which is great for you because you're the only one who'll be able to strengthen yourself. You just need the understanding and the desire and the effort, and you'll get there. So let's all work together to try to end this global chronic pain epidemic. So for now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.